The reason why we entitled the article and maybe the talk this afternoon as a differing view is because we wanted to pause it to put forward a different view of the universal healthcare law, something that would challenge the dominant narrative regarding the law itself and maybe universal healthcare or universal health coverage as espoused by the World Health Organization. While amongst us, tayo, madali tayong nagkakaintindihan at madali tayong nagkakaunawaan dahil sa shared principles natin, we remain in many parts the minority view. And yung narrative na gusto nating i-put forward, hindi masyadong naririnig. Kaya itong particular sa Universal Healthcare Law, dahil napakahirap niyang basahin, I'm sure those of you who have read it, parang tayong uminom ng volume 10. Ano? Ang hirap siyang matapos. It took me several times to, several instances to actually finish the law. Gusto ko siyang i-put forward sa inyo kung paano siya pwedeng suriin contrary to maraming paraan na pinopromote siya, no? Paano ba siya pinopromote sa dominant narrative? One, game changer ang universal healthcare law. Mababago niya yung takbo ng buong healthcare system natin. In fact, kahit yung Senate author si Senator JB Ejercito, lagi niya sinasabi, magiging libre lahat. Now, is that true? Will the universal healthcare law and government seems to be putting all its eggs in this basket? Will it actually change the healthcare system for the better for our people? Now, let me start by saying ano yung rationale or ano yung backdrop pag pinapresent ito ng Department of Health. One, sinasabi nila na kailangan natin ng universal healthcare law because napakamahal ng costs of medical care in the country. Napakamahal at marami naghihirap. We're only one hospitalization away from being impoverished. Totoo yan. Kahit na tayo mga faculty, kung wala tayong inherited wealth at ang talagang inaasahan natin na yung sahod natin bilang guro, pag nagkasakit tayo, ang mahal-mahal ng babayaran, nakakatipid lang tayo because most of the PF we put aside because ano yan, may courtesy, no? Pero otherwise, sa isang empleyado, isang manggagawa, napakahit-mahal ng healthcare. Alam din natin na yung gap na yan nagkakaroon ng reflections sa health outcomes. Yung worst health outcomes makikita natin sa mas mahirap. Pero ito yung isa yung nakakalungkot na sinasabi na undignified care daw is synonymous with public facilities or government-run facilities, poor quality. This is not intentional. And this is not by accident on one hand, kasi talagang pinabayaan naman ang mga public care facilities natin. Pero hindi rin siya intentional in the sense na most of tayo na alam nating mga nagtatrabaho sa public care facilities or government-run facilities, alam natin how they are in duress and working under the most extremely difficult conditions. So, medyo unfair tong statement na to. Pero mas telling sa akin yung pang-apat. Sabi ng DOH, reforms are politically driven but scaled up from previous reforms and anchored on the same goals. Inamin na rin nila na from time immemorial, well, actually they're presenting yung Formula 1 mula kay Duque, kay time ni Gloria Macapagal Arroyo, kahit hanggang dun sa panahon ni Pinoy Aquino, yung kalusugang pangkalahatan, at yung kay Dr. Ubial, kay Secretary Ubial na Philippine Health Agenda, lahat daw yun ay politically driven and scaled up from previous reforms. So finally, inamin ng gobyerno na lahat ng mga policies na pinapatupad niya, pare-pareho lang at iisa lang yung hinahabol na layunin, financial protection that will supposedly translate to better health outcomes. Ngayon, kung susuriin natin yung RA 11223 or yung Act Institutionalizing Universal Healthcare o yung Universal Healthcare Law, kung susuriin natin siya, ang ginawa ko dyan, tinignan ko alin yung mga chapters, and there are 11 chapters, at alin yung mga sections na una, bumabanggit ng PhilHealth or yung national insurance programs at yung related terms. And out of 11 chapters, 10 chapter, isa lang yung hindi bumabanggit ng PhilHealth. At yung chapter na yan ay yung Health Human Resources. Tapos, yung usapin naman ng kung ang hahanapin mo ng mga salita ay yung any term related to financing, private share, yung health maintenance organizations, lalabas na 9 out of 11 chapters ang nagbabanggit niyan. Kaya kung susuriin natin by section, dahil may 16 sections overlapping, 35 out of the 46 sections sa batas na yan, sa pagkakasulat niya, ay tungkol sa PhilHealth at financing. That's 76% of the text of this law is about PhilHealth and health financing. So paano siya natin matatawag na game changer? Paano natin siya matatawag na reforming the health system in a way that is rights-based? Kasi pinag-uusapan lang dito ay financing. So the law itself is a health financing document. And from that alone, reforming the healthcare system based on how it is financed is already anathema to what we believe to be the right way of reforming the healthcare system, which is rights-based. So, kung hahatiin naman natin yung batas, mahahatiin natin siya sa 3 malalaking bahagi. Una, yung provisions na nagpapalakas sa PhilHealth, tawag ko dyan, PhilHealth on steroids. Pangalawa, yung provisions na nagsasabi ko ng mga bagay na ginagawa na talaga ng DOH. At yung pangatlo naman ay nagsasabi ng mga bagay na dapat ginagawa ng DOH, pero hindi. And the point of the last of the 2 parts is that, do we really need a new law for this? So, yung unang-unang chapter, yung Declaration of Principles, kino-consider kong token. Nakasulat dun yung rights-based, pro-people, pero lahat yan hindi reflected dun sa text ng batas. Puntahan natin yung PhilHealth on steroids. Sa chapter 2, no, inilinaw niya na lahat ng Pilipino covered na. Wala nang exemption. Tapos, yung goods and services na matatanggap ng mga tao ay i-determine pa ng health technology assessment. Tapos, lahat ng Pilipino ay may choice daw to register with a public and private primary care provider. Right? But primary care in the text of the Universal Healthcare Law is very minimal. Wala masyadong discussion tungkol doon. Pangalawa, nandun na kaagad sa health services, hinati na yan sa individual and population-based services. Pero dun sa individual-based services, nakasulat dyan that PhilHealth has the right to contract public, private, or mixed healthcare providers. So, pumapasok na talaga na kinikilala yung malaking papel ngayon ng private healthcare providers. At doon din, kinikilala na pwedeng magkaroon ng apex hospitals which can be both private or public as standalone service providers. Now, sa Chapter 3 naman, yung diniscuss yung National Health Insurance, nandyan din yung direct and kinilala sa Section 8 yung membership. May direct contributors at may indirect contributors. So yung direct contributors, yan pa rin yung nababayad ng premium payments. At yung indirect ay yung sagot ng gobyerno. Pero sa sunod na section, kinikilala na yung entitlements ng benefits ng dalawa ay hindi pareho. Tapos ang malungkot dyan, dun sa Section 10, yung binabayaran naman na premiums ay based na sa monthly income in case of flat rate. And I would like to recognize Dr. Butching Paterno, who was raising this years ago. Na ito ay magiging contentious issue. So mamaya pag-usapan natin bakit magiging contentious issue yan. And nilinaw din doon yung board of directors na pina-expand na, naging 13 members na. Pero kung titignan nyo, 5 doon ay agency heads, different government departments, 3 yung experts daw, at 5 yung sectoral reps. Doon sa sectoral reps na yan, isa lang dyan yung galing sa paying members at yung isa ay galing sa non-paying members. Yung isang sectoral reps pa dyan galing sa healthcare providers or tsaka professional groups. So, napakaliit ng papel ng taong bayan sa board na yan. Ano? Pero, kung titignan mo, batay mismo sa press releases ng DOH at ng PhilHealth, ang tinitignan nila ang kailangan likumin na halaga para ma-implement ang universal healthcare ay 257 billion sa unang taon, nalalaki pa sa 280 billion for the second year. Ang malaking tanong dyan, saan mapupunta yan? Sino makakakuha niyan? Pagdating naman sa Section 5, i-reorganize daw ang local health systems ngayon into province and citywide. Pero very silent pa rin paano isosolve yung gaps caused by devolution. Now, may isang section doon, Section 20, na nag-uusap about special health funds na iinog lang dyan sa province and citywide health systems at sa service delivery network. Ngayon, tingin ko dito magkakagulo kasi yan, pera yan, na hindi malinaw paano papatakbuhin yan, paano i-reinvest yan. So, nandun pa yan sa usapin ng paano yan papatakbuhin yung special health fund na yan. At meron din Section 22 na nagsasabing may incentives for competitiveness. Now, itong incentives for competitiveness na to ay para lang sa public care facilities, yung government-run facilities. No? Bibigyan daw ng incentives yung mga government facilities na magpapakita ng mas efficient na function. Ang nakakalungkot dito, kailangan pa makipagkompetensya ka para bigyan ka ng sapat na budgetary allocation ng pambansang pamahalaan. Yan yung batas eh. Hindi pakarapatan ng government-run healthcare system na bigyan siya ng sapat na allocation ng national government. Tapos sa Chapter 7 naman, pumasok na yung regulation at makikita na natin kung dati ang regulasyon ng healthcare system natin ay may dalawang sentro lang, yung national under the DOH at yung local government healthcare system, yung local healthcare systems under the local government. Ngayon, pumasok na yung third pillar. Ginagawa na nila yung PhilHealth. So ang PhilHealth may regulatory functions na rin. Kung babalikan natin, ang PhilHealth ay isang payment mechanism program lang dapat siya, financing program lang dapat siya. Pero ngayon, pumapasok na siya sa regulasyon. At ang malaking tanong yan dahil bakit kailangan pang gawin ng PhilHealth yung dapat ginagawa ng DOH? At nakasulat din dyan, PhilHealth will establish a rating system again with an incentive scheme. So makikita nyo, no, sa tenor at language ng batas, malinaw talaga yung pag-create ng competition, yung market framework, yung capitalist framework, deeply embedded in the law. And this is, for me, a very dangerous provision. Nakasulat din doon na the DOH, PhilHealth, health maintenance organizations, and life and non-life private health insurance, or PHIs, shall develop standard policies and plans that complement the program benefit schedule. Ibig sabihin yan, kinikilala na hindi pa rin sasapat kahit bilyon-bilyon na ibubuhos natin sa PhilHealth. Hindi pa rin sasapat yung coverage na ibibigay ng PhilHealth. At kailangan pa magkaroon ng complementary programs at plans na ilalako naman ng pribadong sektor. At ito kasi yung matagal nang hindi ma-break, na hindi makapasok yung mga private health insurance, yung HMOs, sa healthcare system natin. Now, doon naman tayo sa ano na yung ginagawa ng DOH na nasa batas na to. Unang-una, yung health services delivery. Sinasabi dyan yung population-based services, ganito, ganyan. Pero essentially, yan yung DOH vertical programs na ginagawa na ngayon. Pangalawa, yung organizational setup ng local health systems. Binago lang sa province-wide and city-wide. Pero hindi pa rin sinasagot yung problema ng devolved setup. At pangatlo, doon sa chapter na walang financing at PhilHealth, yung Human Resources for Health, ang nakasulat naman doon ay yung National Health Human Resource Master Plan na matagal nang ulit-ulit ng bukang bibig ng gobyerno, yung master plan na yan. In fact, nung bumalik ako dito sa Maynila in the early 2000s, 2004, 2005, narinig ko sa isang forum yung National Health Human Resource Master Plan. Pero ang nakakalungkot, may master plan tayo, wala pa naman talagang malinaw na bilang ilang doktor, ilang nurses, ilang health professionals, ilang health workers ang nasa Pilipinas ngayon. Walang ganon. So paano ka makaka-create ng master plan na wala kang baseline? Yun yung laging problema. And again, dun sa chapter 6, binabanggit yung National Health Workforce Support System, which is essentially deployment. Yung DTTB, yung Nurse Deployment Program, yung Midwife Deployment Program, yung Dentist Deployment, lahat deployment program. Walang sinasabi how to increase employment, to improve the status of our health workers. And nandun na naman yung Scholarship with Return Service Agreement na matagal ng programa ng DOH. Ngayon, ano naman yung mga provision na dapat ginagawa ng DOH pero hindi pa? Yung sa Health Human Resources, again, yung registry ng all health professionals na ngayon lang nila sinisimulan yan. Tapos nakasulat dun yung reorientation ng medical and health sciences education. Problema mo dyan, may sabit eh. Kasi sa section 4, yung primary care provider, nilinaw na dapat accredited pa, may certification pa from the DOH. So lumalabas ngayon na yung mga graduates ng medical schools natin, hindi pa na mako-consider na primary care provider. Kailangan pa ng isa na namang andana, isa na namang layer para ma-consider siyang primary care provider. Ang tanong, bakit hindi na lang siya i-incorporate? Bakit hindi na lang ipasok yan sa health education system para automatic lahat ng mga graduates ng health sciences natin at ng medical education ay mako-consider na primary care provider? Pangalawa yung sa regulation, laging tanong dyan, bakit kasama ang PhilHealth samantalang ang bukang bibig ng DOH, primary function nila ngayon ay regulation at hindi nila nagagawa yan. Pangalawa, meron doong section na nagsasabi tungkol sa affordability at magtatayo daw ng Independent Price Regulation Board. Kung naaalala nyo, nung dinidiscuss yung cheaper medicine law nung panahon ni Gloria Macapagal-Arroyo, yan na yung version na nanggaling sa House of Representatives to create a price regulation board. Kasi yung version ng cheaper medicine law, galing sa House of Representatives, ang panawagan ay price regulation. Sa Senate, ang panawagan ay competition. Both intending to at least dismantle or at least break monopolies in the drug industry. Pero ang nanalo nun ay yung Marojas version, kaya yung cheaper medicine law is all about competition. Walang drug price regulation, isinantag yun. At ngayon, binabalik. So malinaw talaga na may mga batas dyan na hindi gumagana at ito hinahabol dito sa Universal Healthcare Law. At yung last ay yung governance and accountability. Ngayon lang nila naisip magkaroon ng health technology assessment na matagal na dapat ginagawa. At yung hanggang ngayon, hindi pa rin ginagawa, pero tayo sa PASCOM ay gusto nating panawagan, tayo mga practitioners ng community and social medicine ay laging pinapanawagan yung health promotion, lalo ngayong pandemic. Okay, so ang tanong palagi ng mga pasyente natin, may magbabago ba pag ipinatupad yung Universal Healthcare Law? Contrary to what J.B. Ejercito says, hindi lahat ng serbisyo magiging libre dahil sa UHC. At yan, itong mga infographics na ito ay mismo galing sa Facebook page ng PhilHealth na binatay naman daw nila sa DOH. Sinasabi dito, hindi naman lahat magiging libre. Mapapababa lang ang gastusing medikal ng mga may sakit. Pero sinasabi rin nila na may mga benepisyo habang lumalaki daw yung nalilikom na pera ng PhilHealth na dadagdagan. According to the law nga naman, dapat mag-expand din yung coverage o yung binibigay ng PhilHealth. Pero tignan natin kung ano ba yung coverage na ini-expand nila. Pinag-uusapan dito. Selected medical and surgical procedures, coverage for hemodialysis, PhilHealth Z benefits, which is basically yung mga may hirap na sakit katulad ng cancers, and physical medicine and rehabilitation. Asa dyan ang primary care? Wala, diba? may magbabago pa. Sinasabi nila, hindi lahat ng serbisyo magiging libre. Pero nakasabi din dito, bilang miyembro ng PhilHealth, magiging libre ang konsultasyon kung sa public health centers ka at magkakaroon ka lang ng copay kung sa private facility ka. Ganun din dito sa kabila. Kung na-confine ka daw sa service ward o basic ward o sa accommodation, libre. Pero kung magkakaroon ka ng mas semi-private, may co-payment na. Anong binago niya? Yan na yung existing system ngayon. Pag nagpunta ka sa health center, libre naman na. Wala namang binabayaran doon pag nagpakonsulta ka. Pag nagpunta ka sa private, may binabayaran ka. Ganon din sa mga government hospitals. Pag nasa service court ka, libre ka naman. Pero pag pumasok ka sa kanilang pay ward, no matter kung 6 kayo sa isang kwarto, isa ka lang sa ito, may bayad na. So ano yung binago? Wala, di ba? Pero may mga contentious issues. Ito na yung sinasabi ni Doc Buching dati. No? Yung pagtaas ng premium rates. At ang tatamaan talaga nito ay yung mga self-paying at yung mga migrant workers. At nagkaroon na kami ng ilang discussion ito ng Migrante International, Migrante Europe. Kasi galit na galit sila na ang laki ng binago at ang laki ng exactions sa mga OFWs natin, ng migrant workers. No? Nakabatay na kasi ngayon sa basic salary at tumataas yung porsyento na yan hanggat umabot siya ng 5% sa 2024. Doon sa batas kasi, dati nagpabayad tayo ng flat rate. So kung imagine mo, ikaw ay isang overseas Filipino worker na dati ang binabayaran mo na flat rate ay 300. So sa isang taon ang ibabayad mo ay 3,600. Pero ngayon, dahil nakabate yan sa basic pay mo, at halimbawa ikaw ay nagtatrabaho sa ibang bansa, palagi natin sa Singapore, sa Hong Kong, nasa contract mo, nakasulat doon na ang basic pay mo ay papalo ng something equivalent to maybe 50,000. Ang laki ng babayaran mo ngayon. 2,000 per month. Yan. At sa isang taon, na dating binabayaran mo 3,600, ngayon ay magiging 24,000. Ang laki nun para sa isang migranting manggagawang Pilipino. 24,000. Ang dami mo nang mabibigyan. So yan talaga yung napakabigat. At ang malungkot yan, meron pa silang nalalaman na floor at ceiling. Sinasabi nila, pag ang sweldo mo raw ay 10,000 and below, floor yun, ang babayaran mo lang ay 400. Pero pag ang sweldo mo ay 80,000 and above, ang babayaran mo ay 3,200. Okay. Ibig sabihin, kailangan minimum wage earner ka or less. Kasi yung 10,000 na yan ay minimum, mas mababa pa yan sa daily minimum wage sa Metro Manila. At yung ceiling naman, nakakalungkot na halimbawa ikaw ay full professor sa University of the Philippines at ang basic salary mo ay pumapalo na ng 80,000, pareho kayo ng binabayad. Halimbawa ni Manny D. Pangilinan o yung mga anak ni Henry C. kung magbabayad man sila ng PhilHealth. Pareho kayo ng binabayad. Asa ng hustisya dyan? Yun ang masakit kasi, yun ang nararamdaman. At eto, hindi natin maintindihan bakit ganito ang naging system dito. Isa pang contentious issue ngayon ay yung pagpapasailalim ng lahat ng pondong pangtulong sa mahihirap mula sa PAGCO or PCSO, lahat yan ilalagay na under sa PhilHealth. Ano mangyayari dyan? Dati, pag halimbawa may cancer ang isang pasyente at yung Z benefit package ng PhilHealth ay hindi covered yung kanyang cancer. Neuroblastoma or femoral osteosarcoma na hindi pa part ng Z benefit package ng PhilHealth. Saan siya lalapit? Dati, nakakalapit siya, nakakahingi siya ng tulong sa PAGCOR. Pipila ka buong araw, magbibigay ka ng dokumento, may makukuha ka. Or sa Philippine Charity Sweepstakes Office, pipila ka buong araw, bibigay kang dokumento, pero may makukuha ka. Ngayon, wala naman. So pag wala yung sakit mo, or meron kang sakit, halimbawa yung sa akin na autoimmune illness na pwede ko ma-hospitalize for 3 months, pero ang pinakamalapit na categorization ay rheumatoid arthritis, ang makukuha ko lang sa isang hospitalization ko ay 5,000. Asan ang hustisya doon? At wala na ako ibang malalapitan after that. Under the Universal Healthcare Law, PhilHealth na lang ang may hawak ng lahat ng pera para sa indigent patients. Wala ka ng ibang malalapitan. Ngayon, mismong sa PhilHealth as an agency, ang daming issues na hindi pa nasasagot, hindi pa natutugunan. Yung issue ng korupsyon, palit ng presidente, palit ng top management, hindi naman nawawala yung korupsyon. Maybe because the real corruption, the ingrained level of corruption, is not at the level of the top management. Sure, ang daming sapin-sapin na antas ng corruption sa ahensya niyan. Simply because wala talagang oversight or walang malinaw na accounting. Kahit sa financial mismanagement, hindi nila masagot. Naalala nyo na in-approve ng PhilHealth Board yung OIC, yung OIC nila dahil wala silang PhilHealth President, at na yung OIC nila ay taga Bohol na every week umuwi sa Bohol at nakatira sa hotel during the week na nandito siya functioning as the PhilHealth OIC. Tumagal yun ng mahigit 1 taon. Umabot ng, I think, around almost 1 million yung ginastos sa kanya sa stay niya sa hotel at yung weekly pag-uwi niya back and forth sa hotel. Pinayagan yun ng PhilHealth management. Magkano ang honoraria ng PhilHealth Board dati pag uma-attend ng PhilHealth Board meetings, which is at least once a month. They get 40,000 per meeting. At pag may committee meetings pa sila, they get 20,000. Imagine mo, wala ka pang isang araw. Kaya nga, lumabas yung issue dati na mayroong board member na nakaratay sa kama, may sakit, nasa hospital. Pero uma-attend daw ng board meetings para makakubra ng 40,000 para sa meeting. Paano yan sinasagot? Yan lahat hindi yan nililinaw kung paano yan aayusin. And yet, we're giving this agency 257 to 280 billion of people's money. Paano yan? At ito siguro yung isang pinakamalaking issue. Wala naman talagang malinaw na preba or evidence na habang binibigyan mo ng malaking halaga ang PhilHealth, nagtatranslate yan sa mas mataas na healthcare utilization, sa better health-seeking behavior, and most importantly, some significant na pagliit ng out-of-pocket spending. Ito galing sa DOH Budget Folio Fiscal Year 2018. Pinapakita nila from 2010 to 2018, yung budget ng PhilHealth na 2 billion noong 2010, lumobo ng 57 billion by 2018. 55 billion yung inalaki ng PhilHealth budget in that period. Pero gaano kalaki yung iniliit ng out-of-pocket spending? Hindi bumaba ng 55% ang out-of-pocket spending in that same period. 60, nung simula, nandun na siya, umiinog na sa 60% yung out-of. Pagdating after 55 billion more, nasa 55-57%. At yung latest galing sa PSA ngayon, kung titignan nyo, yung out-of-pocket spending ay halos katapat lang ng share ng government sa total health expenditure. Hindi talaga nagkaroon ng signifikanteng pagbaba sa iniluluwal ng pera ng ating mga pasyente. So we're paying for a healthcare 3 ways. We're paying to our taxes, we're paying through PhilHealth, and we're paying out of pocket. Now, in summary, ano yung sakit ng universal healthcare? One, napaka-dependent pa rin sa PhilHealth. Walang binago, pinalakas lang ang PhilHealth. At lahat ng problemang anak ng PhilHealth at dala-dala niya, dala-dala pa rin niya kahit ipatupad natin yung universal healthcare law. Now, does it represent a major policy? Of course not. It's still very much within the market-based neoliberal agenda. And I will go into that later. Is there a change in the way government will provide budget at the national level and at the local level? Wala. Does it change the way we approach healthcare? No. So walang major policy shift na kinakatuhan ang Universal Healthcare Law. Sadly, and this is one of the more problematic parts of the Universal Healthcare Law, it pushes for equity daw. Kasi ang sinasabi niya, mahalaga sa akin, lahat ng Pilipino makatanggap ng magkaroon ng access sa basic health services. Pero, nandun mismo sa language ng Universal Healthcare Law na some are more equal than others, na hindi pa rin pantay yung tinatanggap ng paying at indirect paying. Kung yung batas mismo ay two-tiered, syempre ang mangyayari dyan, two-tiered pa rin yung services na makukuha. Hindi yan magbabago. At ang masakit nito, and which is why we want to put it forward, if the Universal Healthcare Law is implemented, we're headed towards a direction where the role of private for-profit players, healthcare providers, are entrenched in the system. And that's exactly what's happening in the United States. And that's something we don't want to go into because it's hard to get out of that kind of system. Napakahirap. At yan na yung landas na tinatahak natin. And lastly, paano natin masasabing game changer siya? Samantalang ayon sa batas at malinaw sa lingwahe sa mga probisyon niya, na yung healthcare system natin ay mananatiling curative ang focus, doctor-centric, specialist-oriented, at hospital-based. Makikita yan dun sa lingwahe mismo ng batas na to. Ang pinakamasakit, yung unang-unang problema, bakit mahal magpagamot? Why is healthcare so expensive in the Philippines? Hindi yan nasagot ng batas na to. And that is the problem that was supposed to be solved by this law. Hindi. Hindi yun nakanti. The law doesn't even touch on why healthcare in this country is so expensive. Which brings us to the question, how is this related now to the universal health coverage, the World Health Organization? Because everybody's saying, hey, the World Health Organization's universal health coverage is good. Especially ngayon, may Astana. May Astana Declaration. It's supposed to be taking off from Alma-Ata. And when you say you're taking off from something, you're supposed to be improving it, if not making it happen. Pero ano nangyari? Malinaw mismo sa lingwahe ng World Health Organization that the objective of universal health coverage is that everyone should have access to health services they need without risk of financial ruin or impoverishment. Yan na yung language. Now, makikita nyo, yan din yung lingwahe ng Universal Healthcare Law na. At yan na yung prevailing and seemingly dominant policy and objective ngayon, hindi lang sa Pilipinas but globally. So ano ang problema niyan? Simple lang po, ano ba ang nawala mula sa Alma-Ata hanggang sa Astana? Yan ang tanong eh. Balikan po natin, ano ba ang definition ng health? Health is the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. When we talk about the declaration of Alma-Ata on primary health care, ang objective nun, ang goal nun, ay yung unang bahagi ng definition of health. Kaya nga, nakasulat din doon na the highest level of health is a worldwide social goal. Napakalaga nun. And the attainment of this, of the highest level of health, requires the action not just of the health sector, but of social and economic forces. Ang linaw po sa lengguwahe ng alma ata kung anong kinakailangan. Unacceptable existing gross inequalities are politically, socially, economically unacceptable. That social and economic development are essential for the attainment of health for all, and health being the complete physical, mental, and social well. Pero ano ang goal ng universal healthcare? Nandito lang sa pangalawa. Not merely the absence of disease of infirmity. Kasi nakafocus lang siya dun sa healthcare system. And the fact that people, everyone, especially the marginalized, should have access to health services without being impoverished. Yan yung goal ng universal health coverage. Ang layo po, di ba? Kaya hindi talaga natin masasabi na ang UHC ay health for all. Ang linaw-linaw po na ang tinatahak ngayon ng World Health Organization mula Alma-Ata hanggang Astana ay paatras. At yan po ay nagbabago sa perception natin na ang healthcare ngayon pwede nang maging kalakal or commodity that can be standardized, bound, packaged, given a cost, and then tendered and procured. Ang gobyerno po ngayon ay hindi na healthcare provider. Tagabili na lang siya nitong commodity na to. At yung commodity na to, kaya lahat ngayon ay nilalagyan ng presyo para pwede siyang standard. Kahit sa lengguwahe ng Universal Healthcare Law, there's a minimum health package that everyone should get. So yun yung language na ngayon that has permeated much of the laws and policies that we have. At ang pasyente po ay consumer na lang ng healthcare nito. Kaya yung usapin ng access, yung usapin ng quality care, pinapalitan na yun ngayon ng choice. As if choice is really free. And competition. At lahat po yan ay market-driven. So, kanina nabanggit ko, lahat ito ay dahil dun sa konsepto ng neoliberalismo. Ano ba yung neoliberalism? Sabi ni Vicente Navarro dun sa paper niya na Neoliberalism and its Consequences, The World Health Situation, 2008 paper pa po niya yan. Sinasabi niya, in the health sector, ang ibig sabihin nito, una, a decline in public expenditures in health. 2, privatization of healthcare services. 3, the impoverishing, if not the dismantling of public health infrastructures. Number 4, the full mobility of health professionals from developing to developed countries. Yung pagpunta from developing countries to developed countries ng mga health professionals. 5, the full mobility of medical equipment and drugs, baliktad, from developed countries to developing countries. Ang tawag niya dyan, social dumping. And 6, the full recovery of the biological and behavioral-centric view of medicine. Sa anin pong yan, ilan ang nakikita natin sa Pilipinas ngayon? Lalo ngayong pandemya, malinaw yung anin na yan. Nakikita po natin. Doon naman po sa paper ni Smithers at Nowatzkin 2022 na nilabas nila. Ang paper na yon ay tumutukoy sa universal health coverage bilang isang hegemonic global policy that affects low and middle income countries. Sabi nila, it's important in global health policy that reforms such as the universal health coverage emerge from a political and ideological history. Political at ideological po yung pinaghuhugutan ng policy universal health coverage, universal health care. And these can be at odds with notions of universalism and accessibility within the human rights framework. Ang linaw po na yung UHC bumabangga sa rights-based approach natin sa usapin ng kalusugan. So ano ba yung gusto natin? Hindi naman tayo pwedeng reklamo na lang lahat. Paano ba natin maabot ang health for all? Ang panawagan po palagi ay free. Hindi naman yan free kasi nagbabayad tayo ng taxes. Pero ibig sabihin ng free, yung no payment at point of service. Comprehensive. Hindi siya minimum health package. Comprehensive siya. At progressive healthcare system na meron siyang long view saan tayo patungo. At ano yung mga dapat gawin na kaagad. Dapat direkto na, yung 257 to 280 billion, ang laking bagay niya kung direkto natin ibibigay sa public healthcare system natin. At sigurado tayo ang makikinabang dyan ay mahihirap dahil ang mahihirap lang naman talaga yung nagtsatsaga sa ating public healthcare system. Mahalaga rin po talagang eliminate yung two-tiered healthcare system, yung private and public. Now, alam ko suntok sa buwan yan, pero hindi po mangyayari hanggat nandyan yan at walang regulasyon yan. Napakahirap. At nakikita natin mismo sa loob ng batas ay may two-tiered system. Again, the reversal of devolution is important because people are falling to the cracks. A comprehensive health human resource development and most importantly, accountable, transparent, and inclusive health governance. Pero, nung sinabit po namin yung paper, sabi kanina ni RJ, may paper kasi kami sinabit dati sa social medicine na na-publish doon. Yung isang reviewer, tinanong kami, can a healthcare system based on health as a human right be achieved when providers themselves are organized under a market-based capitalist principles? Yan yung tanong sa amin nung ni-review, sagutin daw namin. Siyempre, ang sagot namin, huwag na sagutin. Baka hindi ma-public. No? Pero ito na lang po ang sinulat namin as a response, that even in a capitalist society, it can be achieved. A rights-based healthcare system can be achieved if the prevailing government policy puts premium on human life and health. Magagawa yan kung yun talaga yung pakay ng gobyerno natin at nakatutok lahat ng agency tungkol dyan. Pero definitely po, ang isang sistemang pangkalusugan that is rights-based is more capable of providing a comprehensive set of services that the people need and deserve than one that is driven by health financing market forces. So I'd like to end my presentation with a couple of slides that says, hindi lang po talaga dapat healthcare system natin nag-uusapan natin. Tayo po lahat sa social and community medicine, kinikilala natin na yung healthcare system natin, sinasalamin lang yan. So in order to really attain health for all, we must address the social determination of health. Hindi lang yung social determinants that are there by accident. They are imposed systematically on us. That social determination, ang tawag dyan, the late Dr. Paul Farmer, is structural violence. And that is something we need to address, even as health professionals, even as members of PASCOM. Now, may guhit po talagang naghihiwalay sa atin, sa sistema natin. Yung mga taong who do as they're told regardless of what is right. And those who do what is right regardless of what they're told. So, nahihiwalay po tayo. But those who are in this side, those among us who everyday struggle to stand for what is right. Yan po yung diwang nagbibigay sa amin. Maraming salamat at magandang hapon sa atin. Ito po yung references ko.